Florida Hospital has recently adopted a process to incorporate interdisciplinary rounds. Interdisciplinary rounds is a way that care providers from different specialties coordinate the patient's care. Various specialties meet to communicate the needs of the patient. Individuals that are included in these rounds are the primary care physician, the bedside nurse, the charge nurse, and the care coordinator, and also the pharmacist. The patient and their family members are also vital team members that are included in the rounds. The goal of the interdisciplinary rounds will help improve communication between all members of the team and not allow the medical team to have more meaningful time with the patients and their family members. By incorporating the interdisciplinary rounds, there should be an improvement with communication between all members of the team, in placing consults in a timely manner, help support post-discharge planning, medication management, and most importantly, increase patient satisfaction and patient outcomes. Here on 4SU, we will be starting the interdisciplinary rounds at 10 a.m. Dr. Go will be the lead physician and will meet with the charge nurse or assistant nurse manager to discuss the patient's priority. The charge nurse or A&M will group the patients according to the bedside nurse's assignments. The charge nurse will notify the bedside nurses when it is their turn to round on their patients. Prior to entering the room, the physician, charge nurse or A&M, pharmacy, care manager, and bedside nurse will present a brief assessment of the patient and current planned state for discharge. The entire team will then enter the room with Dr. Go as lead. Important things to remember during the rounds is sit at eye level with the patient just as Dr. Go is here. Introduce each team member just as he did as they entered the room. Present an assessment and plan to the patient and prioritizing the patient's active problems. Respond to patient and caregivers' questions and concerns. Update the whiteboard with the daily plan discussed. And make sure that the orders are put in the computer and completed, and recap the orders prior to submitting them. After exiting the patient's room, the team should close a loop of communication on patient's care before proceeding to the next patient. Once the nurse has rounded on all his or her patients, the charge nurse or A&M will notify the next nurse to start their rounds with the team. This process will continue until the patients have been seen by the entire interdisciplinary team. Our mission at Florida Hospital is to extend the healing ministry of Christ. Our mission strengthens our commitment to health care, and we focus on healing the whole person, mind, body, and spirit. The spiritual and emotional health are vital elements to the overall well-being of our patients. By incorporating the interdisciplinary rounds process, we are ensuring that the patient is the center of their care. The team will be addressing all their needs, physically, emotionally, and spiritually. Interdisciplinary rounds have proven to decrease the length of stay, decrease readmission rates, reduce in morbidity and mortality, reduction in infectious rates, and as mentioned before, increase patient satisfaction and patient outcomes. The nurse manager will follow up with the physician, nurses, and care management team to ensure every team member is contributing to the rounds and if all needs are being addressed. Leader rounding will be done on patients and family members to ensure their needs are being met, and if they have any concerns regarding the routine and the effectiveness of the rounds. Continuous monitoring of process and outcomes will be done by the nurse manager. Consistent buy-in from the entire team is paramount for sustainability. Feedback is needed to ensure the patient and the team needs are all being met. Interdisciplinary rounds have been proven an effective way to provide safe and exceptional care. Here at Florida Hospital, we are excited to add this process into our daily routine.